Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Imipramine. Its brand name is Tofranil. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So, Imipramine belongs to a group of compounds known as dibenzazepines. The exact mechanism of action is still currently unknown. However, it's thought that it acts by blocking the uptake of norepinephrine at nerve endings. In terms of indications for use, imipramine is indicated to be used in the treatment of depression. It can be used to treat nocturnal enuresis, and some off-label uses would be for binging, diabetic neuropathy, panic disorder, and urinary incontinence. Before somebody was to use imipramine or Tofranil, there are some contraindications they must clear, as well as some precautions and warnings that they should be made aware of. Patients would not be able to use imipramine if they've used a monoamine oxidase inhibitor in the previous 14 days. Patients would also not be able to use this medication if they had a hypersensitivity to imipramine or any other dibenzazepines. And finally, it would be contraindicated during the acute recovery phase following a myocardial infarction or a heart attack. Now, in terms of precautions, imipramine is on the Beers criteria, which is a list of medications that the elderly population should either avoid or use cautiously. Because of the anticholinergic side effects and sedation, this medication may put these patients at an increased risk of falls, therefore fractures. Patients who use this medication with a history of cardiovascular disorders should be monitored more closely. Patients may experience arrhythmias or conduction delays with imipramine. Cardiovascular toxicity, congestive heart failure, as well as myocardial infarction may occur with the use of imipramine. Some patients may notice a fast heart rate or tachycardia. Risks and benefits must be weighed carefully if a patient is using imipramine and is to undergo electric shock therapy, as the risk of a hazard from this therapy may be increased. Patients on imipramine should avoid the use of sympathomimetic amines, which would be found in products such as decongestants or local anesthetics. Photosensitization has been reported with the use of imipramine. Patients may be at an increased risk of experiencing cardiovascular toxicity if they're using imipramine and have hyperthyroidism. Some patients have reported an increase or a decrease in their blood sugar levels. Pathological neutropenia may occur with the use of this medication. It should be discontinued at the first sign of this. This medication should be used cautiously in patients who have a history of convulsive disorders, as it does have the potential to lower the seizure threshold. The presence of bipolar disorder should be ruled out before treating a patient with imipramine. This is because manic or hypomanic episodes have occurred in individuals using this medication. It should be used cautiously in patients with renal impairment. And lastly, patients should be made aware that strokes have been reported with the use of this medication. Now, once somebody is cleared of those contraindications and made aware of the precautions and warnings, and they start to use imipramine or Tofranil, they can expect to take their dose in tablet form. When patients are using imipramine to treat their depression in hospital settings, they can use 100 milligrams in divided doses throughout the day. In certain situations, this dose can be increased to 300 milligrams daily. For outpatients treating depression, they can use 75 milligrams daily, again in divided doses throughout the day, and the maximum dose would be 200 milligrams daily. The usual maintenance dose turns out to be 50 to 150 milligrams daily. When patients try this medication for diabetic neuropathy, they can use 25 to 150 milligrams daily, usually given in 2 divided doses. For urinary incontinence, they would try 25 milligrams at bedtime. The dose can be increased by increments of 25 milligrams to a maximum of 150 milligrams at bedtime. As with all medications, there are some side effects or adverse reactions that patients may experience while using imipramine, so I'll go over some of those here now. Weight gain, constipation, and xerostoma have occurred. Some patients experience headache, dizziness, or somnolence. Blurred vision, urinary retention, and fatigue have also occurred. The more serious side effects would be agranulocytosis, jaundice, angle closure glaucoma, worsening of depression, and finally the emergence of a psychotic disorder. That's all we're going to talk about today with imipramine or Tofranil. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.